Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, the podcast turns to the devastating floods in Pakistan with two terrific guests. To appreciate the scale of the disaster, I speak with Dr. Debbie Guha, the head of the Center for Research on the Epidemiology of Disasters at the Louvain School of Public Health in Belgium. Next, I discuss the role of climate change with Dr. Ben Zaitchik, a Johns Hopkins professor of Earth and Planetary Sciences. In our conversation, Professor Zaitchik notes that these floods in Pakistan are a warning to us all. Let's listen. Dr. Debbie Guha, thank you so much for joining us on Public Health on Call. What is the situation right now with flooding in Pakistan?
Yes, well, the flooding in Pakistan has been very, very severe this year. It really has. I mean, Pakistan is a country that does see repeated floods. This is not the first time. In fact, one of its biggest regions, which is called Punjab, we have part of Punjab is in India, and part of Punjab is in Pakistan. Punjab itself, the word itself, means 5 rivers. And these are massive rivers that come down from the Himalayas and the Karakoram range into this country, into the Indus Valley and so on and so forth. So Pakistan is no stranger to floods. That's true. Neither is Afghanistan, and I'll put in a word about that later on. But this time around, it has been extremely severe. I follow floods and mostly human disasters, and I have not really seen such severe floods with such extension. 33 million people are affected.
33 million people, that is incredible. How else do you measure the impact of floods?
Well, I have to just point out, I come from a background of public health and epidemiology. So obviously the impact of floods for me simply means an impact on the human population. So how does it affect human beings? Because it has other impacts, very important impacts as well on topology and erosion and things like that. But for humans, I would say most remarkable impact is, of course, on disease, on waterborne diseases, or exposure-related diseases. So in other words, when you have floods like this in poor countries, but also in maybe poor areas of, say, the United States, which has a lot of floods, Mississippi and all of that, the main impact on the human beings are infectious disease. So anything related to contamination of water, or waterborne diseases, so contamination of water, meaning diarrheal diseases of different sorts, but waterborne diseases which are linked to vectors, mosquitoes, and other bugs that fly around and live in water, and they carry disease.
So there are 33 million people potentially at risk for those consequences.
They are. And the more malnourished you are, the less you're vaccinated, the more susceptible you will be to illness. This is true for all countries everywhere. So if you're a malnourished child, and that goes for obesity and for thinness. So if you're a malnourished child, you're likely to be much more affected, much more easily by these diseases. And there must be access, public health access to these people who are exposed to it. And that's not always the case, neither in the United States nor in Pakistan.
What about direct deaths from the flooding, people drowning? Has that been an issue in Pakistan?
It is. The number of people who have died so far, more or less, I think numbers around 1,600, just below 1,600, which is a very large number for direct deaths. Floods typically is not a natural hazard that kills a lot of people. This is not earthquakes. Earthquakes will kill 24,000 in one shot or even more. Storms, cyclones can kill up to 80,000. Like a whole city in one shot. Floods are not like that. Floods are normally disasters that don't kill a lot of people. It affects a lot of people, agricultural ground and things, but don't kill. So 1,600 recorded deaths So in case of Pakistan, there may be many deaths that are not recorded. So we don't even know, and we will probably never know. So 1,600 deaths is a lot of deaths. And those are typically drownings, but drownings of very often of women, because they very, very rarely, they have been taught how to swim. So even in very shallow waters, women or little girls or young girls can drown because they have not been taught how to swim.
So you've got severe consequences immediately, and then a population exposed to long-term consequences that can include death if you consider diarrheal diseases and vector-borne diseases. That population is greater than the population of Texas, approaching the population in California. So it's an enormous number of people affected. Is there anything that we should understand about how countries can prepare, or how Pakistan has prepared? What is the strategic way to prevent the consequences or respond to the consequences that we should understand?
Right. Pakistan right now, its efforts for it to protect its people or prepare its people against floods, which is probably the most common natural disaster in the country, has really been very bad. Not to use the word appalling, but has been very bad. In other words, the government or the state authorities have nowhere close to done enough, despite having several years of warnings that floods is a big hazard, floods occur all the time, floods are killing people, floods are affecting the livelihoods of people. Having all of that, the government has been really not up to the task.
I'm just wondering what you would hope the government could do.
First of all, I think, which is not in my domain, but maybe more in Ben or engineering domains, there is quite a lot of advances made in low technology, low cost flood prevention. So in other words, ways to have embankments, not fancy embankments like we have here in Germany or other places, but very low cost, low tech flood prevention engineering structures to prevent the waters and to control waters from the rivers. Those can be done. There can also be very good programs in evacuation of populations in high-risk areas. How do you get populations out very quickly to teach them that, take care of the warnings, and when there is a warning, this is what you should do. So those are things, this is community-based actions. And those are things that have been done successfully in Bangladesh and in parts of India.
So policies can be improved because this almost certainly is not going to be the last major flood. It remains a high priority. What can people do who are just hearing these terrible stories and worried about Pakistan? What would you recommend that they do to help at this point?
I think there are not much choices right now in terms of Pakistan. I think people from outside, people who want to give support or show some solidarity with the victims of the floods, they really, at the end of the day, they have to depend right now on the reliable, well-established humanitarian organizations like the Red Cross, very reliable Red Cross, or Save the Children, or Oxfam. There are these big humanitarian, and as far as the people outside, people who are in the United States, what can they do to support? They really have to right now support these big organizations, because Pakistan, the government itself, is not in very good shape to deal with this.
Well, Dr. Guha, thank you so much for talking with us. I want to take this very serious situation and pivot to even the bigger picture with Professor Zaitchik. Thank you so much for joining us.
Thanks for having me.
So you've just heard about the catastrophic, frankly, situation in Pakistan from Dr. Guha. I wonder if you could, take a step back from just Pakistan to look at the whole planet. You're a professor of Earth and Planetary Sciences. Why are we seeing such severe flooding? Could it have something to do with climate change?
Yeah, absolutely. So as Dr. Guha already indicated, floods have happened throughout time. Right. And we have some places like Pakistan and other areas which are particularly susceptible to large floods because of the monsoon climate and the number of rivers that converge there. That said, it's really been robustly shown that we are seeing increases in all kinds of extreme weather under climate change. And the reasons for this depend a little bit on which region and which extreme we're talking about. But in the case of the kind of severe rainfall that's been associated with these floods, we understand that we're going to see more extreme rain events under climate change on average globally. And it's a fairly simple climate change response. If you warm up the air, it holds more water. If warm air holds more water and that air is then blown up against the mountains, like in a monsoon system, or is in a hurricane or in a convective thunderstorm system, then when the rain begins, there's more fuel for that rain. And so all that water vapor that the warm air is holding will simply result in much more intense downpours, much larger rainfall yield out of these storms, right? And so we're talking about Pakistan right now. We could also be talking about Hurricane Fiona at the same time. So this kind of idea that you're going to get more rain out of an existing storm system or monsoon system is fairly well understood. And then there are a number of other issues we could add on to that, but that's the first order.
So I apologize if this is an uninformed question, but it follows from what you're saying that where the rain will fall is not exactly random, that the rain is falling where the rain has fallen before, where there are mountains or particular systems. It's just that the air has more water in it. And so there's just a lot more rain.
That is absolutely the first order response. What you just alluded to is something else, right? Are we going to see changing patterns, changing seasonality, right? The monsoon rains came a little early in Pakistan this year. And that's all areas that people like me spend a lot of time researching and trying to understand how maybe the jet stream is changing, or maybe some feedbacks with the terrible heat wave they had in Pakistan before the floods might be involved. And there is definitely evidence of all of those kinds of dynamics. But the first order, warm air holds more water. There's more water, there's more fuel for storms, and it's going to rain more.
So as you think about mitigation activities for climate change, flood prevention by like the kinds of engineering structures that Dr. Guha was talking about and flood response to evacuate populations, those would be pretty smart investments now.
Well, absolutely. And where I think this gets difficult and interestingly difficult is when we talk about what we call the no regrets adaptation, right? With things we should do anyway. I mean, we should have better drainage, we should have better wash infrastructure, we should have all of these things. Then when we look at a changing climate, we can ask ourselves, well, what do we have to do that's different? And can we do what in my line of work we call proactive or anticipatory adaptation? So we're not just saying, wow, this was a bad flood, let's make sure it doesn't happen again. We're saying we're actually going to see changing in the frequency and the intensity of these events here. And so we need to be planning for events that are either unprecedented or used to be rare that aren't anymore. And that's a hard thing to do, right? That's a hard thing to do politically, economically, socially, to say, I'm going to be ready for what's coming next. And yet that's a grand challenge of the coming decades, right? We're going to see severe flooding in places that are not used to seeing severe flooding. We're going to see rising seas. We're going to see more extreme storms, more extreme heat. And what do we do as a society, everything from individuals up through governments and international organizations, to make sure we're getting ahead of this?
So it sounds like you think it would be a mistake for people to read the news and think like, wow, this flooding situation is terrible in Pakistan. Glad it's not coming my way. Nothing for me to do.
Right. And I mean, I think as Dr. Guha already alluded to, I mean, what we saw in Kentucky earlier this year, what we're seeing regularly in parts of the United States, that again, floods have always happened. But when you see people realizing like that, there's the straw that breaks the camel's back, right? Maybe it's not the first flood, maybe it's not the moderate flood, but it's that flood that you hadn't seen before, or the second or third time it happens. When either you decide to leave or that decision gets made for you by your insurance company, by some other larger decision maker. And we absolutely need to be ready for that.
I imagine that, you give talks on this. You talk about how more floods are coming and the planet is changing, and you give the message that maybe people don't want to hear, that they're going to need to make investments that even go beyond the obvious things to do. How is that received?
Well, I mean, I think that this is a challenge we have in the climate world, right? I mean, people now are talking about, depression and doomerism, as they say, about the climate system. I'm definitely not on that side of the fence. I mean, I think so many of these problems we need to address anyway, right? Climate change is a stressor. What I was just alluding to is the fact that, yeah, we need to do more. We might have some really unprecedented systematic change that we need to deal with. In fact, almost certainly we do. And so how do we get our governance structures, certainly our engineering solutions, but much more importantly, our decision-making processes? How do we come up with solutions that are democratic and robust, as well as being flexible and able to move quickly? And all of that is daunting, but I think that the solution space for climate change aligns pretty well with the solution space for a lot of other challenges that we should be taking on. And so we need to think of this as an opportunity as well as a challenge.
So the situation in Pakistan, unquestionably a catastrophe. for people who are there, 33 million people affected. It's also, in a sense, a wake-up call for the world to pay attention to the full spectrum of consequences and places that will be affected by climate change.
Yeah, absolutely. And so, for people like me who've been working on climate science and policy for some time, right now is a time, I think, of certainly concern, worry, and impending thresholds. So there's a lot of reason for real motivation to act quickly. There is some optimism in the fact that, well, we're talking today, right? Pakistan had terrible floods several years ago, as we all know. Other events have happened over recent years. I'll be honest, as a climate scientist, it's only in the last 2-3 years that consistently my phone rings because people want to talk about how climate is impacting us and what we need to do. And so I think from there's some reason for optimism because it means we're all going to be working together in ways that maybe we weren't talking to each other before in trying to bring some of the disasters that we're seeing to a place where they're really motivating meaningful action.
Well, this has been a great opportunity to talk to you, to talk to Dr. Guha. Thank you, Dr. Zaitchik, for joining too.
Thank you, Josh.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.